Hi, it's Dr. Andy with your daily COVID-19 tip. So the tip for today is to know your local public health authority. Know your local public health authority. So why is this important? Well, what I found and what I learned what I learned when I started to be trained in public health, and what I found over the years is that most of us, when we think of public health, we think of one organization, and that's the CDC, which stands for Centers for Disease Control and Prevention. CDC and Prevention. But that is the name of the CDC, Centers for Disease Control and Prevention. And the CDC is our federal, is what we typically think of and is really at the middle of federal public health activities. However, it's important to realize that the federal government has some limited roles in public health. The Constitution, which defines what kind of authority different governments have, leaves most of public health authority to the state. So what do we do at the federal level? Well, here's Atlanta. That's the headquarters of the CDC in DC. Definitely the federal government is helping with border control, with coordination across all states, and with research. Most of our funding for good research comes through the federal government in some way. And so this is not just bench research, this is the research that helps fund epidemiology and helps us find out how things are being spread. A lot of that comes through the federal government. These are probably the key ways that the federal government's involved. But there are some other authorities that they have, some other powers for quarantine and whatnot, but most of that authority really rests with the state. That's what the Constitution, where it leaves it. So for me, that's Arizona, and so Phoenix is our capital, and most of the funding for these basic public health activities then, and the authorities are at the state level. And how that happens in your location will depend on how the state has set that up. Most states have continuing public health activities at the county level. In some large cities, it's at the city level, and sometimes it's a combination, some kind of combination organization that combines city and county authorities. But this is really where the rubber hits the road of public health activities going on, is here at this local level. So they have they should have the best advice for you, the state and local, and again, it depends on how the state set it up in your area. It could be that the state is really the authority in your area, but there may very well be a local authority as well. Look to your state, and I'm going to continue to give you tips, but you should always take that in perspective of what your state or your local authority is telling you, because they're the ones that know precisely the numbers in your area, what's going on in your area, and have the best specific advice for you. So I'm going to give you general principles, and even I'm just discussing the US here, and there may be people watching this from other places as well. The key is know what your local authorities are saying. Take the principles that I'm teaching you, but always take it in the context of what you're hearing locally, who has the best information, knows the different kinds of activities, knows how well they've funded and how well their programs are operating to keep people in their area safe. So that's your tip for the day. Know your local public health authority and how that works.